When you have a stable joint that loses its stability, the joints above and below are going to have to compensate by becoming more stable and losing mobility, and vice versa. Now that set one has been completed, let's start talking about today's theme, and we're going to talk about joint pain and some tests, assessments, and treatments that you can do on your patients. First, before we actually get into the actual assessments, I want to get into what we're going to be discussing today, and that is going to be the joint by joint approach. The joint by joint approach, this is something that was developed by Mike Boyle and by Gray Cook, and it's a way of looking at the body in alternating patterns of mobility and stability. So from the ground up, every single joint, it works in alternates. At the foot is meant as a stable joint. The ankle is meant as a mobile joint. Knee is for stability. Hip is mobility. Lumbar spine is stability. Thoracic spine is mobility. The lower cervical spine and middle cervical spine is meant for stability, and the upper cervical spine is meant for mobility. That is going vertically, then going across. The scapula is meant for stability. The glenohumeral joint is meant for mobility. Elbow is a stable joint. Wrist is a mobile joint. And then the hand is a stable joint. What happens is when you have a stable joint that loses its stability, the joints above and below are going to have to compensate by becoming more stable and losing mobility, and vice versa. So if you have a mobile joint that loses its mobility, your stable joints are going to have to become more mobile, and that is going to cause dysfunction in the body. So what we would want to do is assess every single joint in the body, and especially if somebody's experiencing pain at one joint, you want to look to the joint above and below, because unless somebody had direct trauma to the actual affected joint, it's usually never going to be the actual joint that's affected itself. So if somebody comes presenting with knee pain, it's almost never going to be the knee unless they had direct trauma to the knee. 99 times out of 100, it's going to be due to either dysfunction at the ankle or the hip. So you would want to take a look at the ankle and hip. And during the subsequent rest periods, we're going to be taking a look at those different joints. But for right now, we're going to take a little bit of a break, and then we're going to move on to set number 2. That was just a tiny taste of what can be found in my members only section. If you enjoyed it, become a member for only $5 a month to get access to hundreds of member only videos.